Happy Monday, everyone. I hope everyone has had a restful weekend. Today, we are going to continue our discussion from 2 weeks ago about medical imaging. If you missed the post about the CT imaging, please make sure to check it out. It's really interesting. This week is all about magnetic resonance imaging, or an MRI. What is an MRI and why is it done? MRI is a diagnostic tool that gives detailed views of the body's internal structures without using radiation. This is important for aortic disease, as the complexity of the aorta's structure and close proximity to vital organs require high-resolution imaging for an accurate assessment. Not only is it useful for cardiovascular imaging, but also for soft tissue evaluation, injury assessment, and cancer detection. It's a versatile and powerful tool in medical diagnostics. There are different types of MRI machines, open or closed bore. We like the open ones. An open MRI consists of a magnetic above and under you and a space for you to lie. Basically, you're sandwiched between two magnets. Some patients prefer this type because it alleviates claustrophobia that occurs with closed bore MRI. However, due to the lack of coverage, open MRIs lack resolution compared to the closed bore. Closed bore is the traditional MRI type that most people think of. It has a ring of magnets and uses radio waves to create images, which is different than a computed tomography or a CT scan that uses X-rays. Here we have an image of an MRI. This is a closed bore MRI machine with a patient laying there, about ready to go in. And then here we have an image of the open MRI machine. That looks a lot better. And a patient there getting their imaging done. So how is an MRI done? MRI is non-invasive and painless, though it can be lengthy and noisy. First, patients need to remove all metallic items to avoid interference with the magnetic field. Second, the patient lies on a table that slides into the scanner, similar to a CT scan. Now, inside the scanner, magnetic fields and radio waves are used to align water molecules in the body. Then the magnetic field is turned off, which triggers a signal from these molecules. Finally, a computer translates the signals into an image. Pretty cool, right? I think so. MRIs can take anywhere from 15 minutes to an hour, depending on the complexity and body part involved. And here we have an MRI image, an image from an MRI of the ascending aorta, pulmonary trunk, superior vena cava, and the descending aorta. So where is an MRI done? MRI scans can take place in various settings like a hospital, outpatient imaging center, dedicated MRI clinics, or a mobile MRI service. Are there risks? MRI scans are considered the safest diagnostic tool when compared to imaging techniques that uses radiation, such as X-rays and CT scans. However, because of the strong magnetic field, patients with metal implants like pacemakers, cochlear implants, artificial joints, or metal clips that are used for aneurysm repair should notify their health care provider prior to the scan. Advances in technology have made newer implants MRI safe, but verification is always needed. Also, MRI scans can trigger claustrophobia in some patients. If you experience this, talk to your provider about an open MRI machine. As always, remember to communicate with your doctor about specific risks and benefits of any procedure. Thank you for tuning in to this week's Medical Monday. I hope you learned some tidbits about MRIs, and join me in 2 weeks to learn about transesophageal echocardiography. Have a great week, and always think aorta, Samantha. That is really interesting stuff there.